What your fingernails say about your health. Our eyes may be the windows to the soul, but your fingernails can be the window to your overall health. It turns out that having strong fingernails isn't just beneficial for your manicure. Certain fingernail symptoms can be a larger indication of health issues. Whether you have brittle nails, yellowing nails, or just have the bad habit of biting your nails, they can say a lot about your health, according to John Anthony, MD, a dermatologist at the Cleveland Clinic in Ohio, and Deborah Holloman, MD, a New York City-based dermatologist and author of Skin Rules. There are certain nail symptoms that you should not ignore. Remember, if you notice any new nail symptoms that you have not noticed before, be sure to contact a medical health professional to rule out any possible health problems and concerns. Before we begin this video, don't forget to hit the subscribe button for more daily tips like this so you never miss our new videos. Now here are the most common health warning signs that your fingernails will show you. Number 1. Yellow nails. According to WebMD, yellow nails are one of the most common warning signs that your fingernails can give about certain health issues. WebMD also adds that one of the most common causes of yellow nails is a fungal infection. But in rare cases, yellow nails can also indicate a more serious condition such as diabetes, thyroid disease, or even lung disease. Dr. Anthony adds that yellow nails could also be a cause of smoking, which can stain the nails. So you might want to quit smoking if you notice that your nails are constantly yellow. Yellow nails can also be a sign of a vitamin or mineral deficiency, which may mean that you need to change your diet or even add a multivitamin supplement to your life. In other cases, yellow nails can also be a symptom of psoriasis, while in extremely rare conditions, it could be a sign of cancer. There are many different ways you can try to get rid of yellow nails. Although it all depends on the cause, yellow discolorations on the nail can be removed or treated using certain home remedies like oregano oil tea, tree oil baking soda, or vitamin peroxide. Although certain home remedies work, you should always consult a physician before trying any home remedies. By consulting a medical professional, he or she can first determine what the underlying cause of your nail discoloration is and provide you with the treatment from there. Number 2. Cracked or brittle nails. Brittle nails, also called 𝐁𝐞𝐥𝐻, affects 20% of the population. This condition typically affects women more than men and is characterized by weak nails which break, peel, or split very easily. According to Dr. Holloman, cracked or brittle nails can be a sign that the nail plate is extremely dry, like yellow nails. Cracked or brittle nails have been linked to thyroid disease. Dr. Holloman explains that hypothyroidism is a condition where the thyroid is not producing enough hormones. Nails can become brittle for a number of reasons, and there are several different symptoms that you can look for that you may have brittle nails, including difficulty in growing them, longitudinal ridging, and more. Some people are more at risk for developing brittle nails, while there are also certain factors that put people more at risk for developing brittle nails. This includes iron deficiency, frequent washing of hands, sunburn, exposure to cold or dry weather, exposure to chemicals, or repeated injury or trauma to the fingernail. To prevent brittle nails, you should reduce water exposure to your fingernails and stay hydrated if you tend to get your hands wet often. When cleaning dishes, you can buy a pair of protective gloves to protect your hands. You should also stay hydrated and use natural hand creams, which can help moisturize your hands and nails. Number 3. Pitted nails. According to Medicine Net, nail pitting is caused by the defective development of the layers of the nail plane, and it is common for those suffering from psoriasis. They add that nail pitting can affect up to 50% of people who are suffering from this condition. Dr. Holloman suggests that if you are experiencing any pitting or dents in your nails, you should speak to your doctor. Number 4. Ridged nails. Dr. Anthony explains that the reason people will see horizontal ridges in their nails is that there could be direct trauma to the nail, or it could also be a cause of a more serious illness, in which case you'll see it in more than one nail. He adds that the reason this occurs is that your body is working overtime to try and fight the illness, so it is saving its energy for the rest of the body that needs it. More in basic terms, your body is saying the nails are not important enough for energy. Number 5. Discolored or dark lines. Beneath the nail discoloration or a dark line on the nail can sometimes be caused by melanoma, which is the most dangerous type of skin cancer. Dr. Anthony elaborates by stating that melanoma that comes from the nail unit is extremely serious, and it can also cause a black line in a stripe on the nail. So if you notice this, you should contact your doctor immediately. Melanoma is a very serious type of skin cancer which begins in the cells of the skin, destroying tissue and spreading to other parts of the body. Not all dark lines underneath a person's nail means that they have cancer. The United Kingdom's National Health Service states that these stripes are very common among African Americans who are above the age of 20 years old. This symptom is called melaninochia and is a condition which occurs when cells in a person's nail called melanocytes make extra pigment. This makes the nail beds darken in color. It is estimated that 50% of African Americans have this condition. Another cause of black lines showing underneath the nail is a splinter hemorrhage. A splinter hemorrhage occurs when blood vessels underneath the nails are damaged. This can occur as a result of an injury. Number 6. Bitten nails. According to Medical Daily, the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM, classifies nail biting as one of the symptoms of obsessive-compulsive disorder. However, this does not mean that everyone who bites their nails has this disorder, but Dr. Holloman does explain that when this habit becomes excessive, you should consult your doctor. Sigmund Freud, the famous neurologist and the founder of psychoanalysis, stated that nail biting could be an indication of a fault in a person's psychosexual development. Other experts state that nail biting can be an indication of boredom and/or stress. Experts also state that nail biting could be a way that some people ease their anxiety. It could also be a way that certain people deal with loneliness or frustration. Number 7. Bluish nails. When your nails become bluish, it is a sign that the body may not be getting enough oxygen. Possible causes could be lung problems and heart problems. If you notice that this is happening on a continuous basis, you should consult your doctor. Blue fingernails can be caused by low levels of oxygen circulating through a person's red blood cells, and this is a condition known as cyanosis. This condition makes a person's fingernail turn a purplish blue color. It is also possible for colder temperatures to turn fingernails blue. This is because cold temperatures can force a person's blood vessels to constrict. These narrow blood vessels make it very difficult for oxygen-rich blood to get to another person's nails. Number 8. White spots. White spots are called leukonychia, which is a condition in which white lines or dots are present on fingernails or toes. There is a myth going around that white spots on nails mean calcium deficiency, but Dr. Anthony explains that this is not typically the case. He adds that the white spots are not very significant as they are often a result of trauma such as hitting your finger against something possible. Other causes of white spots or dots on a person's fingernails include an allergic reaction, a fungal infection, a nail injury, or a mineral deficiency. If you notice any strange changes to your nails, such as yellowing nails or dark lines on your nails, and are unsure of what may be causing the changes, consult your doctor to rule out any health problems like melanoma or vitamin deficiency. It is always best to consult with a medical professional before trying to diagnose or treat any discolorations yourself. If you have bad habits due to stress which make you bite your nails, you can also consult with a professional to find out other ways to relieve your stress. Have you experienced any of these nail issues in your life before? Let us know in the comment section below. Enjoyed this video? Hit the like button and subscribe to our channel for more videos like this. Thanks for watching.